Welcome back to Learn with Professor Janula. If you're a nursing student, this channel is just for you. Don't forget to subscribe and hit the bell icon. Today we're learning about involution of the uterus. So go ahead, subscribe, and let's get started. Involution of the uterus simply means the natural process that takes place after childbirth, where the uterus gradually shrinks and goes back to its normal size, shape, position, and condition, just like it was before pregnancy, and this happens because the uterine muscles contract and the tissues slowly heal during the postnatal period. The purpose of involution is to help the uterus safely recover after childbirth, where the strong contractions of the uterus reduce bleeding and prevent postpartum hemorrhage. At the same time, the uterus gradually returns to its normal non-pregnant state, allowing the area where the placenta was attached to heal properly. This healing process also helps the menstrual cycle slowly return to normal, showing that the uterus is recovering and getting back to its regular function. In terms of duration, involution starts immediately after the baby and placenta are delivered, so it begins right away in the postpartum period. From that point, the uterus gradually shrinks day by day, and in most women this whole process is usually completed within about 6 weeks, or roughly 42 days after delivery, as the uterus returns to its normal pre-pregnant size and condition. Now we will see about physiology of uterine involution. After the baby is delivered, the uterus doesn't just relax and stay there. It actually starts contracting strongly and regularly. Think of it like the uterus tightening itself to go back to its normal size. These contractions are really important because they press on the blood vessels where the placenta was attached, and that helps stop heavy bleeding after delivery. Many mothers feel these contractions as crampy pains, which we usually call after pains, and you'll notice they are often stronger in women who have had more than one baby, because the uterus has stretched more and needs to work a bit harder to shrink back. Now let's talk about autolysis. During pregnancy, the muscle fibers of the uterus become big and thick to support the growing baby. And after delivery, the body no longer needs them to stay that large. So what happens is, the uterus slowly breaks down these enlarged muscle fibers into smaller units, and the proteins from them are reabsorbed back into the bloodstream and reused by the body. Just remember, the muscle fibers are not destroyed or lost. They simply shrink back to their normal size, helping the uterus return to its pre-pregnant state. Now, let's understand regeneration of the endometrium in a simple classroom way. After delivery, the inner lining of the uterus, called the endometrium, starts repairing itself, and this repair mainly happens from the basal layer, which is the deep layer that remains intact. The area where the placenta was attached heals naturally by shedding and renewal, a process called exfoliation, and not by forming scars, which is really important for future pregnancies. Most of the endometrium finishes healing within about 3 to 4 weeks after delivery, while the placental site takes a little longer. But overall, this process helps the uterus return to normal and get ready for the next menstrual cycle. Let's go through these uterine changes after delivery. Immediately after childbirth, the uterus is still quite large, and you can feel it at the level of the umbilicus, which is completely normal. As the days pass and involution continues, by the end of 1 week, the uterus has reduced in size and comes down to about midway between the umbilicus and the symphysis pubis. By around 2 weeks after delivery, it has descended fully into the pelvic cavity, so it's no longer easily felt on abdominal examination. Finally, by about 6 weeks postpartum, the uterus has returned to its non-pregnant size and position, showing that involution is almost complete. Now, let's talk about the factors that actually help involution happen faster and more smoothly. Breastfeeding plays a big role here because when the baby suckles, oxytocin is released, and that hormone makes the uterus contract well, helping it shrink back. Early ambulation, meaning getting the mother up and moving as soon as it's safe, also helps because it improves circulation and supports normal uterine contraction. Keeping the bladder empty is important too, since a full bladder can push against the uterus and stop it from contracting properly. And finally, good nutrition really matters, because the body needs enough energy and nutrients to heal tissues and support the whole involution process effectively. Now let's look at the factors that can slow down involution, just like we'd explain it in class. If the uterus is not contracting well, which we call uterine atony, it stays soft and enlarged, so involution becomes delayed. Retained placental fragments are another common reason, because any bits of placenta left inside keep the uterus from shrinking properly. Infection, especially puerperal sepsis, also interferes with normal healing and uterine contraction, making the process slower. An overdistended uterus, like in multiple pregnancy or polyhydramnios, takes more time to come back to normal because it was stretched more than usual. And finally, something as simple as a full bladder can delay involution, since it presses against the uterus and prevents it from contracting effectively. When we talk about nursing interventions, the main idea is to support the mother and help the uterus return to normal smoothly. We encourage breastfeeding because it naturally increases oxytocin, which helps the uterus contract well. We also assist the mother with early ambulation, helping her move around safely, as this improves circulation and supports involution. Making sure the bladder is emptied regularly is important, since a full bladder can stop the uterus from contracting properly. Teaching good perineal hygiene helps prevent infection, which can otherwise delay healing. And throughout all this, we closely monitor for any signs of hemorrhage, so that problems are picked up early and managed quickly. So that brings us to the end of this session, and I hope this explanation made involution of the uterus feel clear and easy to remember. If you found this helpful for your studies or revision, don't forget to like the video, share it with your friends, and drop a comment if you have any doubts or topics you want next. Make sure you subscribe for more nursing notes made simple and easy, and thanks a lot for watching. See you in the next class.